the 7th, 2020 Bladen County Commissioner meeting. At this time, we'd like to welcome everyone that's here, as well as we welcome Reverend Bruce Miller from Hickory Grove Baptist Church. Mr. Miller, if you'll come up at this time to the podium and have prayer for us, and then immediately following after we stand, Mr. Martin will lead us in a pledge.
Thank you again for the privilege.
Yes, sir.
Gracious God Almighty, we do thank you that you are God over all. We thank you that you're here with us. Lord, I'm thankful for each one of these commissioners, and I pray that your hand of guidance and direction will be upon them. We thank you, Lord, for them, for their commitment, for their devotion, not only to their immediate constituents, but to our whole county. Father, again, may you be glorified, may your people's needs be met, and may we all live together in harmony and peace. In Christ's name I pray. Amen. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Before we approve the consent items, I'd like to first of all say that it's been an honor and a pleasure to look back to be your chairman of this board. Appreciate all the support that I've had. Last couple of weeks, I had a little setback in Bell policy. There's a lot of prayers coming out. God answered every one of them. I'm here doing well. Haven't been sick 1 minute other than paralyzation. But God bless. 15 years ago, I had it. There was 8 of us had it in this county at the same time that I'm aware of. And I was fortunate to come back 100%. So I pray that that'll happen again. With that being said, I welcome all the new commissioners and all the ones that have come and gone before us. Thank you for all the time and your dedication and service to this county. And I look forward to a good year working with each and every one. And I pray we do the right thing for this county, all of us. With that being said, I hope everyone had a chance to review and approve the consent items. If we have, can I get a motion to accept? Motion to approve. Got a motion by Mr. Peters, second by Dr. Mungoins. Any further discussion? All in favor say aye. Aye. Opposed? So moved. Thank you. Mr. Martin, over to you, sir.
Mr. Chairman.
Yes, sir.
I'd like to make a couple of remarks about item 3, if I could, sir.
Yes, sir.
I have received several phone calls from the citizens. They had questions to me about the election of officers for this gathering, and I assured them I would speak of their concerns. Now, several of the phone calls from the public and some from the employees, they were asking why there was had not been an African-American chairperson. And I attempted to explain that how we go through the election process. The callers are saying that this appears to be racist and prejudiced and biased condition that they have only seen lately. The chairmanship, according to what has happened, has been rotated just twice between 2 commissioners, Commissioner Peterson and Commissioner Brick. They tell me that this seems strange. These are my callers calling me, and I assured them that I would bring this before the body. They're saying that it's been indicated that none of us have the ability to be the chairperson. That this is coming from Commissioner Britt. But that really is unbelievable, though. It's unbelievable.
Can you repeat that again, sir?
They're saying that you had indicated that none of the African Americans had the ability to be chairperson. But I told them that seemed unbelievable, though, because 3 of us have college degrees. I don't think you would say anything like that, but that's what the citizens are indicating.
Well, you're 100% correct in what you're saying, sir.
Now, the callers are also concerned about the department heads in the county. They're saying none of those are minorities as well. I know this is not the time for that, and but then again, they're saying the upcoming election is not real, that this is something that we're just going through, the process. And that's all I have to say, sir.
Mr. Martin.
Thank you, Mr. Chairman. The new members of the committee look forward to working with each and every one of you for the veteran Bladen County. At this time, we'll have the election of board officers, and we'll begin with the office of chairperson.
Mr. Martin?
I recommend Mr. Charles Ray Peterson, sir.
Mr. Martin, I nominate Dr. Munn Goins as chairwoman.
Okay, we have nominations for both Mr. Peterson and Dr. Montgomery.
One thing I'd like to say about her, she is a lieutenant colonel retired from the military, and she has proven herself that she has demonstrated leadership skills through the military. So she has possessed the capability to be chairperson or chairwoman of the Bladen County Commission. So I commend her for her military service, and she is a lieutenant colonel.
Thank you. Are there any further nominations for the office of chairperson? I hear none. Okay, nominations are closed. Those in favor of Mr. Peterson for chairperson, signify by saying aye.
Aye.
If we could have a show of hands. Okay, Mr. Peterson has a majority.
But thank you for consideration. Thank you, Mr. Bullock, for nominating.
Congratulations, Mr. Peterson. At this time, we will have election for the office of vice chairperson.
I'd like to nominate Commissioner Mark Gillespie.
Mr. Gillespie has been nominated. Are there other nominations?
Nomination be closed.
Okay, nominations are closed. At this time, those in favor of Mr. Gillespie for vice chairperson, please signify by saying aye.
Aye.
Any noes? Congratulations, Mr.
Thank
Gillespie.
you.
Thank you.
So let me just say there's a lot of new faces here, and I'd like to welcome you to the Bladen County Board of Commissioners. Hopefully have a great year. Everybody got sworn in tonight, except Arthur and I, because we didn't have to run, but everybody else is sworn in tonight. So thank you. So item 4 is recognition of employee suggestion award recipient Jeff Cook. Nathan and Jeff, if you please come forward.
Back in early May, about when COVID, a little bit after COVID got ramped up, well, let me take it back a little bit further. Back when I started about a year and a half ago, we identified some issues with our 911 center, with the CAD system we currently have. A lot of servers and stuff were being outdated. We'd had them beyond our life expectancy. We did kind of a cost analysis of what it was going to cost to get us done, and it was going to be somewhere around $800,000. Obviously, you know, we're limited on funds with certain things. So when Jeff started with us back in June or July of that year, we kind of, myself, Sheriff, Jeff Secretary, kind of tasked with the idea of finding us some funding to make this happen. So Jeff took it upon himself, the initiative, to apply for a grant with the 911 board. A lot of man hours were put into this. He had to do several presentations. Obviously with COVID, they were all virtual, but he had to do presentations with that over a virtual setting with the 911 board. And we received a grant in the amount of $334,937.99. The total project cost to do this is going to be roughly a little bit over $700,000. And luckily, only a small portion of that is going to come from Bladen County citizens. So I want to commend Jeff on the job well done. You saved the citizens of the county a great deal of funds that could be used for other things. So thank you for all your hard work. And I know on behalf of emergency services, and I know I speak to the sheriff's office, we appreciate everything you do for us on a daily basis. And I'm proud to work with you every day.
Jeff, on behalf of the Bladen County Board of Commissioners and the citizens of Bladen County, I'd like to present you this token for your hard work. And thank you. Thank you. Anyone have anything?
I got a couple of them.
Mr. Mike?
To make a range about. I spoke with Mr. Martin about this, and I know at one time we were having meetings by teleconference, and we would make arrangements. And I inquired with him today if the board could convert back to that same type of arrangement where we could do the meetings by phone instead of being in person. And he said that he thought that we could still work it out. Am I correct?
I think we can
My
handle it.
reason being is that I was looking at the rate of COVID virus going around. I was trying to stay in line with certain things, and I want to know if that service is still available. And Mr. Martin, could I get some clarity also in the future as to how closed session would be handled in this particular type of event? So if I need to be a part of the closed session part of it, if you would bring me up to breast with that, you can do it at a later time.
Okay.
Just give me a call. The other thing that I want to take a look at, we starting now with a whole new set of board members. It's the first time I've been on here. I think we got four new faces on here. And at one time, we had a snapshot of our employment situation in the county where we looked at who was where, who was holding what positions, how the system was structured. And I would like, Mr. Chairman, that Mr. Martin would provide to the board all of us an overview that he gave to us once before. It's not something new. Of the departments, the department heads, the ethnicity, the race, the gender, the salary of each one, and go through that administrative process as to how that is broken down as far as the managerial part of each department and the number of people that's in departments by race. He gave that to us at one time. Just to get an overview of our employee structure. That's the only thing I'm at.
That's good. You all right, Mr. Martin?
Yes, sir.
On the teleconference, if you plan on doing that, just let them know ahead of time and share all that information with all the commissioners.
That's what I'm saying. I want you. That's why I was thinking about converting back to that, and I didn't know whether we had some type of arrangement. I talked to Mr. Martin about that. Whether we had to go back and revise or rehire or redo something with it, but if it's available, that's why I was asking that it would be available for us to have that service if we need it.
Well, Mr. Chairman, is he referring to teleclaim or
I think he's
or
referring
Zoom?
to I think he's referring to like a go-to meeting or Zoom. Or
Zoom.
Whichever
you
one
can
it
see
is, I want to be where.
You'll be able to be visible on the.
Yeah, Zoom.
The only thing I'm
Same
saying.
thing we had in place before. It's just
That's right.
still-
You know, all the meetings we've been doing, we've been on the phone, I could be beating out of South Beach with East Point, and everybody's always on.
Right.
That type of arrangement. That's the arrangement I'm saying, but that's still be available for the board.
Good. Anyone else?
Mr. Chairman,
Well,
I just want to ask Mr. Martin, do we have any other outstanding funds or available funds through the COVID-19 grants and so forth? Any of that still?
There is still for any what type of amount of you.
Well, we had some at one time where small businesses could apply, but I think the deadline has run on that.
It has.
Do we still have a balance there?
We pretty well. I'm gonna review that later when we talk about
Oh, okay.
another matter. And
Oh, that's fine.
that's good. Okay.
My issue is prior to the same thing.
Okay.
And one other thing, I'd like to thank all the commissioners and commend us for supporting the grant to build a new school in Tar Heel. I really appreciate that. I think that was a great thing. That's it, sir.
Anyone else?
One last thing, Mr. Martin, what kind of timeline are you looking at getting that report?
which report?
The one I was asked about with the employee status.
That won't take any. That won't be long at all. We provide that quarterly.
Can we have that next available for the next board meeting?
Certainly.
Okay, all right, thank you.
So you just touched that, see how detailed you want to go in, where, I mean, we need to know how detailed you want to go into the weeds or how long it's going to take.
Okay, that's what
That's
I'm
all
saying.
I asked. Okay.
But I want to make sure it's shared with all the
Oh,
board.
yeah.
Everybody has the same information.
Anyone else? Okay. Division Agency, Ms. Kelly Robinson.
Good evening. Congratulations.
congratulations to all the new commissioners. In your packet, you will see, I'm sorry about my voice, I'm just not there, guys. In your packet, you'll see that I have a proposal to hire a part-time in-home aide using some of our CARES funds, and I would like to see the approval for that this evening.
Motion by Dr. O'Sullivan Goins, second by, got you, Mike? Brett, Mr. Brett, any more discussion? All in favor, say aye. Aye. All opposed? Thank you, Ms. Kelly.
Thank you very much.
Health Director, Ms. Terry Duncan.
Good evening and welcome to the new commissioners. And we'll be meeting later on to discuss the Board of Health responsibilities, so I'm excited about that. The first item is the consideration for approving the full-time shelter attendant position that was in your packet for review last month.
So, are the new board members, what we have in place now is 2 part-time, and we want to make that 1 full-time, so it can't be part-time. Okay. Is there a motion to approve?
This is one that we had laid on the table, right?
We left it on the table, yeah, last time.
last time.
So it wouldn't have to lay on the table for these new commissioners, we just process right through it.
No, it just says 1 meeting.
Make a motion to approve.
Motion by Mr. Brett to approve, second by Mr. Rodney Hester. Any more discussion?
Mr. Chairman, the funding for this, is it made up by a grant or something different between the two? Or is that revenue from the county?
General fund revenue.
General fund revenue? Okay.
Any more discussion? All in favor say aye. Aye. All opposed? Update regarding COVID-19.
Well, as we learned at our last meeting, that the vaccine was soon to be coming. And we are expecting that the FDA will grant the emergency release authorization as early as Thursday of this week. Realizing that Pfizer was the first to submit, followed closely by Moderna, and now they have the third. North Carolina is expecting to receive the first shipment, and it will be Pfizer, according to our most recent information. The hospitals will receive the first vaccine. It will be very limited at that point. The hospitals will work to phase in their healthcare workers, of course, the ones that are taking care of COVID patients first. And that would include all of the clinical staff, environmental staff, and each hospital system is working on that. Followed closely by that is the long-term care facility staff and residents will be in our first limited dose, and it will be limited. Yes, sir.
I think one question on that. I had some nurses I was talking to, and I hadn't even thought about it. And they brought up a point to me. They said that 2 of them said they were reluctant to take it because they said they didn't, by this being a quick vaccine and the process that it's gone through, what if you gave vaccine to all your healthcare workers and providers and it had some type of after or some kind of effect? Are we looking at giving it to everybody that's in that zone and not worrying about it? But they were saying what would happen, all of them got some kind of after effect after, then you would have no healthcare workers. Have y'all looked at that scenario?
It's recommended, first of all, there will be no federal nor state mandate for the vaccine. There may be agency mandated, but not by the federal or the state on the state level. And then as far as the vaccination of healthcare workers, there are some recommendations that the staff are altered so that if someone had, just like the flu, you can have the flu vaccine, you can have mild reactions to that. So to stagger the vaccination of the healthcare workers.
So y'all got that worked out even now that.
Yeah, the hospital systems are working on that. Yes, sir. The long-term care facilities and, of course, our EMS workers are included in the healthcare population, as well as when we put in our provider for the health department to be a provider for vaccines, we also included any of the physicians' offices that would not be related to the hospital, such as dentist offices, So those healthcare workers are also included in our proposal.
Council Parker? So if you're talking about all of Bladen County, dentists, chiropractors, physicians, doctor's office, as well as their staff?
Now, they may not be in the very first, those first healthcare workers are the ones that are going to be working directly with COVID patients or more exposure to COVID patients. Because if we were going to the dentist or a chiropractor, we would assume that those folks are more or less at risk for having COVID and are more well than persons going to the hospital setting.
Because of their need.
Right.
I've had several hospital employees, it's basically going to be a mandate as to what they're feeling like from, for example, you know, your systems that are doing it. I think it's pretty much something you're going to be required, is what I'm hearing from a lot of those first responder folks. I don't know how much of an option it's going to be.
And that is left up to the individual agencies.
Right.
Will the employee be affected if they refuse to take it?
They could be, yes, sir. Just as now, the flu vaccine is mandated in most hospital settings.
So it's mandatory for that staff to take those shots?
That's
Is that
correct.
what you're saying?
Unless there is a religious exemption or a major medical exemption, and you have to apply for exemption status at that in most hospital settings.
Okay. All right.
So we have increased our testing. We are testing now Monday through Friday at the health department from 9:30 a.m. until 4 p.m. That will be up until Christmas week. We will test on Monday and Tuesday of Christmas week, picking back up on the Tuesday following Christmas through the end of that week. Our contract with OptumServe goes from month to month, and they are in negotiation to extend that contract. And we would extend our testing at that point and still have the Monday through Friday. Since we met last time, we added the Tuesday and Wednesday so that we could offer the testing. Remember that that one is free. If you do have insurance or Medicaid or Medicaid, we do take that, but if not, it is free out of the pocket. We do have available flu vaccine until it runs out, free for people that do not have monies. So you do not have to have an appointment at the health department to get that vaccine.
On there, I know the VA has a different strand. They have two different, I guess, vials, different ones. So which one did Bladen County?
For the flu,
Yes.
we have 3 different kinds. We have that group for the older than 65, we have that middle group, and then we have the group that just is in general. Now, we may run out occasionally, and then we just have to wait on the state to get it back, because we've given a lot of flu vaccines this year. That is one of the mitigation efforts to help with the COVID vaccine, or the COVID virus, not vaccine.
Dr. Duncan, what is the response time on your testing?
Right, we're doing the PCR testing, so the contract says they have 72 hours. However, it leaves the health department somewhere around 4 to 4:30, and the results are back usually the next night or the next day. Occasionally, it will take a little bit longer, but I say roughly 36 to 48 hours.
All right, thank you, ma'am.
Ms. Duncan, one other question. Will you be making the determination as to who received the shots, the vaccination? Who will be making that determination?
No, sir. The CDC and North Carolina DHS are making those based on the phases, and there are several different phases. Again, the first ones are the healthcare workers, and then the long-term care facilities, their staff and residents, and then followed by residents that have 2 or more comorbidities or 2 or more diseases. We know that the people will not have to provide proof that they have 2 comorbidities or 2 illnesses. They will be taken at their word.
Well, I say, but who's going to be overseeing Bladen County, particularly with who gets administered tests?
Well, the first doses will go to the hospital setting, and the hospital will determine which of their healthcare workers get that. And then it's already been determined that the long-term care facilities will be next. And we've worked with entities such as CVS, Walmart, and Walgreens that will be administering the vaccines to the long-term care facility. And in the first batch that we get, it's going to be split between the healthcare workers and the long-term care facilities. And the first batch will go to the hospital city. And then after that, when it's opened up, then we will have some mass distribution of the vaccine. But it will not be anticipated until after the first of the year.
So the health department won't be handling all the phases of it?
I'm sorry?
Your department, the health department, will not be the overseer of all this?
No, sir. The hospital system is going to oversee that first group that they get for the healthcare workers because, again, they're the largest component, that the largest population of healthcare workers. So the CDC changed their guidelines last week for quarantine, and North Carolina DHA did put in their updated return to school guidelines. Some guidelines that we would follow the CDC. We're anticipating some additional guidelines from North Carolina DHHS to follow the CDC guidelines. It would go from a 14-day quarantine to a 10-day quarantine and possibly a 7-day quarantine if you have a negative test on day 5. A little bit of caution there. We have people that have tested on day 12 and day 14 positive after they were in close contact with someone. So a lot of thought and effort is going into that one. So what do our numbers look like? You know, when I was here last week or a couple of weeks ago, that we were on the increase, and we certainly have continued that. As of today, there were 399,362 positive cases in North Carolina, with 5,560 deaths. 341,041 recovered, which gives us overall an 85.3% recovery rate as of today in North Carolina. That's down from what was running about 88%, 87%. Currently hospitalized, we have the highest hospitalization rate today of 2,240. And we have a 10.5% positivity rate in the state. Remember, we want our positivity rate to be 5% or less. So in North Carolina, there have been an excess of 5,600,000 tests performed. In Bladen County, we have had an excess of 16,000 tests performed. Currently, we have 1,447 positive cases with 170 active cases. We have 20 deaths, one more from when we met last time. Our number recovered is 1,257, giving us an 86.8% recovery rate. And that is down, usually we're running in the 88 to 90% recovery rate. We currently have 5 in the hospital, and we have a 9.7% positivity today. The counties that are closest to us, Robinson, Columbus, and Cumberland County are running greater than 10%. New Hanover, Brunswick, Duplin are running in our same category in that 7 to 9%. So we have more than triple our positivity rate in a month. We had, about a month ago, around the 50-60 range of active, so we have more than triple that rate as well. And when we look at the demographics, currently we have 49.6% are Caucasian, 26.5% are African American, 57.1% are non-Hispanic, with 23% Hispanic. Any questions?
Yes. Now, what are the recommendations for Bladen County right now? What would you tell us to do? What's
continue those 3 W's. Wear the mask, remember to watch your social distancing, and to wash your hands. I mean, it is the very basics. Remember that wearing a mask is that one inexpensive tool that we have.
Ms. Duncan.
We tripled though, but we tripled in a month. And now it's getting cold, with most people inside. We got to be done with it.
Well, and again, avoid crowds. We know that every time that we go out in a crowd, that we put ourselves at risk. And if we are out in crowd A today, crowd B tomorrow, crowd C, eventually the statistics will run against us.
Ms. Duncan, the last question I want to ask is when we gather here in this room, and I'm looking at who's in here now, and I'm listening to what the governor and Manicoan is saying about group meetings and stopping group meetings, not recommending group meetings, settings like this. Do you feel confident here in Bladen County that we should continue these type of settings?
The recommendation is that we do the online or WebEx meetings, Zoom, go-to meetings whenever possible.
Yeah, so what I'm saying, the capacity here is above what the state is recommending at this point. That we're
That's
sitting in here right now with. So do you recommend us meeting? What's your view?
I recommend that we go back to guidelines.
That's what I'm thinking.
My department, the Division of Health and Human Services Advisory Committee is still meeting via web.
I'd like to point out that we are, in consolation to that we are, taking full respect of social distancing though here tonight. In other words, I think, in other words, we are not, and I read a lot of this material just like you do, and I'm sure you do too, but we are not one on top of each other. So I think respectfully that we're doing that. So
Everyone has on a mask. We are
right. So
taking
you hear two
appropriate
rules. You
precautions
hear
with
mask and you hear social distancing, and I think we're observing one of the good rules about that. We're doing this, and we're so.
Now, the only reason I asked the question was we follow the CDC guidelines that they're specifying, the governor that they're specifying. And right now, we in violation of that rule. We are in violation of it, regardless of space.
Government does have an exempt. I mean, they
The
did
government does
exempt
have exempt, yes.
for meetings like this. I mean, I'm just saying.
But I'm
as
just
far as
saying, if you're
technicality.
exempt, you're still not following the guidelines to say the positivity rate and the transmitter rate.
I'm just, yes, sir, I just wanted to clarify, we're not violating any kind of state law.
Anyone else?
Yeah, I want to add to that. So are we still doing temperature bar when they come in? Are we doing that at all? Checking temperature when they come inside the building?
At the front door, yes, ma'am.
Are they doing?
To my knowledge, they are.
They're doing them at social services.
Right. And that's part of the thing. But see, some people can be asymptomatic, so then I worry about that. Even when I go to stores and people there, you don't know. Well, they're young folks are not wearing masks. We know they're positive, but then they still come to the store. So there's nothing in place to penalize them or to take them home or send them home to be quarantined. So at this point, they become super spreaders. And I would hate to come to another meeting at this point, and I will let the chair go. This is my last person meeting because of the age, most of us are here, or of age. We're not teenagers. And it's important for us to understand that, take care of ourselves. And the information that we're passing to each other, it can be done on Zoom. So, Mr. Chair, I sure hope that we will make that decision tonight.
You better have to do Zoom the whole time.
Mr. Chairman, yeah, that's been available to
All the time, all year.
Well, it will be for me tonight. I'm just letting you know, Mr. Chair, this is my last one.
That's
Thank
fine.
you so much.
Yeah, and,
Mr.
Brad will send something out for you, next one if you want. That's good.
Okay.
And I'm just kind of
Mr.
taking the
Chairman.
same position.
Mr. Glover?
I just want to ask Dr. Duncan, do you have any statistics on the cases male versus female?
Yes, sir, it's just about half. there's 50.4 female and 48.8 male.
48.8, 50.4.
Yes, sir.
All right, thank you, ma'am.
And then the highest age group right now is the 25 to 49, 39.9, followed by the 50 to 64, 22.7.
All right, thank you, ma'am.
Okay, anything else? Maybe we can get that information sent to us, Mr. Martin, those numbers and stuff. Okay. That helps. Next item is, general service with Kip McLaren, update regarding illegal trash.
Good evening.
Good evening.
Welcome to the board, to all of you folks on board. This is my first time addressing you. I was asked to look into what's been going on in a couple of our locations across the county where there have been some illegal disposal of solid waste on the roadside. Drafted a memorandum, I think you may have that in the board package to Mr. Martin, updating what's been taking place on a couple of these sites. The Lost Road, Watson Graveyard Road site, the Sheriff Department assisted us approximately a year ago with this site. During the time it was under investigation, they did some surveillance out there and actually reported to me that they had issued 3 citations to different individuals who they were able to identify were using that site as an illegal dumping site. Following that, we got the assistance of the NCDOT and the Sheriff's roadside cleanup crew that went over and did a site cleanup. Since that has been done, we've been back. It was reported again that that site was starting to collect waste again. And since I was asked to look into it this next time, we have the Sheriff's Department again doing surveillance on that site. I included the Kennedy Store Road site on that as well, and they are doing some surveillance out there also. Now, we have not done a cleanup on either of these sites since the most recent reports, but I do want to address that with you tonight if I might. We are not equipped in solid waste to go do roadside cleanup. We never have been. I think back in the days when we had dumpsters on the site, the staff and the crew worked really hard to clean up what was collecting around the containers on the roadside. But since we consolidated our operations and went to man convenience sites, a lot of that illegal dumping slowed down. Doesn't mean it completely went away. There are some provisions in the solid waste policy. There's 26 pages of that policy, by the way. And when you get back into the language of abatements and cleanup, the language largely addresses nuisance piles and illegal dumping that starts to accumulate on private properties, and puts a lot of that emphasis on the landowners being responsible to see those sites don't happen. Now, we do have, and again, we do have litter enforcement authority through the Sheriff's Department, the general statutes in North Carolina. That's also addressed in our solid waste policy. Or if we can find evidence, we can cite people for illegal dumping, and that's the process by which we're taking now. The real situation that we're seeing on Kennedy Store Road and we're seeing on Watson Graveyard Road is accumulating on the roadside and spilling over into private property. Some of that stuff on Watson Graveyard I've been into myself, and it goes up into private property for a ways there. And it's been there for a long time. Some of it's got vines growing over the top of it. It's been there so long. The problem with that was that if the property owners were seeing it and telling us about it, and they were taking some action themselves, these could probably be eliminated early on. But for whatever reason, that became a disposal site again. And again, the Sheriff's Department, they said they issued the citations. All of the citations issued were within the residents live within 3 or 4 miles of those sites. They were driving over, dumping their waste, and driving on the way. We literally saw trash bags just thrown out of vehicles and swung out on the side of the road. And we want to encourage people to use our convenience sites. That's why they're out there. That's why we keep these things open as late in the evening as we do, to make it as convenient for the people to use, even working people on Saturdays, to make it as convenient for people to use as we can. Back to what I said, we really don't have staff for roadside cleanup. Our staff's focus and goal that we're at such a minimal staff level at solid waste operations now, when one man's out, it slows the whole operation down terribly. We're supplementing right now with part-time and temporary workers to help get us through, since we're not using inmates right now. We haven't had inmates since the COVID started. So we've had to hire temporary workers at the site to help us facilitate our operations there. And as you know, we have contracts with Greenway to maintain and man these convenience sites. So of our options, if we are going to step up and create something more than what the sheriff's been able to do for us, it's going to cost us some money. We've got to talk about how we would budget that and how we would put things into place, whether we would hire contractors to go out and do the cleanup for us. Again, through budget cuts with the state, the NCDOT is no longer doing roadside cleanup at all. So we're having to do our own, and this is where the sheriff and I worked together a couple of years ago to create the inmate cleanup crew. He again has been hindered by the COVID because they're not prosecuting as many cases, so we don't have as many of our own inmates in-house to send out and staff that crew. So that whole operation has slowed down tremendously. But we put forth effort. We're just in a situation right now where if we do more, we've got to construct something and it's going to cost us.
Mr. Chairman. I said, thank you, Mr. McCleary. Has the site at White Oak been paid? Someone was calling about it, the dump site at White Oak?
At White Oak?
Yes.
No, sir, not been paid.
Not been paid.
Not on the list to be paid this year, no, sir.
Mr. Chair, the citizens of Bladen County deserve some type of reprieve from the county and from the state. I understand that some of them is personal property, but then you have all that on DOT. That's their responsibility, and you stay on the county have to take over. So we have to do something. Some of it becomes a safety hazard. I'm not so much, maybe not so much for the water, but because you have garments and other things go into those areas, it really does become a health department issue. And we have to do something. I understand that we don't have a lot of money. I understand that you can't prosecute. Why can't we prosecute you? Or can we at least use our policy to notify people?
And may I address that? We are using our policy to notify people. When we go out, myself and Greg Elkins share this duty. We go out, we investigate a site, we find this debris, we try to contact landowners and property owners, send letters. Many times they do not respond, so then we do a follow-up visit. We try to catch someone at home so we can talk to them about it. And most of the time, when we do make personal contact with people, they work to comply. It's the ones who are not the landowners that are throwing the stuff out on the roadsides, that then we employ the use of the sheriff's department to do the investigation, to set up the surveillance, and they do surveillance, to try and capture the ones that are doing it. They can get license plate numbers, they can follow that up, and they can catch the cars that are coming through and throwing this debris out. And they're doing that remotely with remote surveillance. And that's where the 3 citations have been issued. And those people have been given warnings, been given fines, and told to go back and clean up. And they did do some of their own removal. They didn't clean up the site entirely. That's where we employed the use of DOT, and they went out with trucks and equipment to help us clean that first site up in Watson Graveyard for the first time. Now, I have a call in right now to Mr. Nick Gerald with the DOT waiting for his response to see if they might assist us again. And they're doing that on a pro bono basis. They're not helping it, they're not charging us, they're going out and helping us do this. But again, we really don't have staff of our own staff and we need employees and everything. But have you and Ms. Coleman or Ms. Martin taken an overview at our profit and loss cost factor on this to see how much labor we can put into place before it becomes a deficit? Have you looked at the overview of where we at and how much we take in and what we make?
Well, as you know, we raised solid waste fees this year to compensate for our losses. We were already going into negative from the last 2 years since we renewed solid waste contracts.
Since Hurricane Florence.
Since Hurricane Florence, the tonnages went up, as well as did our disposal fees going to Sampson County, and our transport fees going out. When we renewed contracts, we put it out for bid and renewed contracts. The best price we could get, it still caused an elevation in our costs.
The question I'm asking is, do we need to try and handle the cost internally, or can you go to general funds and get it, Mr. Martin, to support him during this time of crisis, or where we at?
Well, I don't know exactly what the remedy would look like.
Not yet.
To go on private property.
We haven't put a comprehensive plan yet together to say if we employed a crew to go do these cleanups, what that overall cost would be.
How many, like you did like a one-time cost or something like that to get it cleaned up, picked up and say, oh, we're over and done with it? Have we looked at anything of that nature? Just to get it done and say, okay, the problem is being remedied now, let's try and keep it enforced.
I would like to ask this question, and if I may. What if we tried to create a community effort where we literally put a dumpster down there beside the road and ask the citizens of that community that are concerned about it to come help clean that up and put that stuff in the containers?
That's what I'm saying.
And we've done that.
Yeah.
And we're trying to take out trash, people, not even, some of them, not even Bladen County. They're Columbus County, Brunswick County, and I'm saying there are some complaints, but the majority are not. When those tires, we realize those tires, we don't have a business in our area, in our small town, that disposes of tires. So they came from someplace. It wasn't East Arcadia. You have citizens in Lisbon, in that area, and most of these are senior citizens. They can't clean that up. I don't think we should expect them to do it. But we have to do something. Now, I'm asking you, how big is the fine?
Say again?
What's the fine?
It would be whatever the standard littering fine is enforced by the general statute. The general statutes of North Carolina give us guidelines on the fines and what enforcement can take place and how it takes place. Again, it has to be enforced by uniformed officers, sworn uniformed officers. So therefore, that's why we employ the use of the sheriff's department. And then those littering fines are literally set by the general statutes enforced.
So they had perfect.
Yeah, we're talking about trash and whatnot that would be the state right of way spilling onto a private landowner?
Correct.
Sometimes, yes, sir.
Okay, so
Sometimes.
the
yes.
county, I wouldn't imagine the county would be in a position to go clean up private property. I
No,
wouldn't-
That's the challenge.
That is one of the challenges.
That's got to be a great challenge. Of course it is.
And Mr. Chairman, as Mr. McClary just explained, that's already taken place on Boston Graveyard Road not very long ago. And it's just,
But when I started bringing this up over a year ago, maybe if we start surveillance there, and it cannot be just a passing technique. It has to be surveillance 24/7, 7 days a week.
And there was. There was.
Yeah, and so,
I'm familiar with what the sheriff's department is doing in that location, and they established surveillance there 24/7.
so hopefully they can tell me who put those tires.
And that's how they were able to actually catch those three and issue the citation.
I thank you. I really do appreciate you and the sheriff, the work you've been doing. I really do. But I'm telling you, our citizens do need your help, and a lot of this trash is on the right of way. It's not their problem. International Paper is one of them. Hopefully you'll contact them and they can clear their area.
Mr. Cliff, I would suggest that you do a press release about our policy and reach out to the landowners and make sure they understand what the policy says. It's kind of their responsibility. What little bit of land I got, I circle every once in a while. And I would also ask that, Greg, we send a letter to William and Raven and all those and ask not roadside help, but ask for site, but maybe use the word to get litter dumps cleaned up by DOT.
And Mr. Chairman, just for clarification, what, Kim, if I'm not mistaken, what you're referring to as a policy is actually an ordinance. So it's a local law.
It is local law.
Mr. Clerk, can I ask you one question? This is talking about trash. What magnitude of trash are we talking about? You talking about like household waste? Wood?
Watson Graveyard Road, it was a mixture of everything from furniture, appliances, scrap tires, car parts, household garbage. It was just a conglomeration of any type of waste you could think of. Kennedy Store Road, I'm sure the file is also the same thing. It becomes just a convenient place. We'll go down there and dump it and drive off, and people just, it's literally a lack of respect for the land and a lack of respect for the neighborhood for people to do this.
But the reason I was asking that is no way that they could actually fence it off and do something to keep them, no way to keep them out of this.
Well, if they were fenced off, that would be the responsibility of the landowner. They could do that. And I've said this too, being a property owner myself, if people were dumping on my property, I would stop it. You know, your recourse is when they've been warned to get stuff off the land, don't dump it on my property, then the next course of action is contact Sheriff's Department, have that person cited for trespassing and illegal dumping. So if we had landowners in, Watson Graveyard is very much a vacant lot. There's properties on down on either side, it's very much a vacant lot that they just targeted for these disposals. Kennedy Store Road, that's the corner of a vacant lot. So, yeah, and it's usually where there might be some woods with an opening and then start dumping on the opening.
Mr. McCleary, have deer cameras been utilized any time?
They have been using surveillance, yes, sir.
Okay, thank you, sir.
Thank you.
Item 10, Soil and Water Conservation District, Dean Marshall. Regarding North Carolina Department of Agriculture and Consumer Service Conservation Easement Project.
Okay, this is relatively new Bladen County, but something the NCDA is promoting is conservation easements and land trust. I'm going to read to you this. What is a conservation easement? It is a legal tool that restricts residential, commercial, and industrial development of land to maintain its agricultural production capability. The purpose of these easements is to ensure the land remains in agriculture, horticulture, or forestry production. The conservation easement is recorded in records of the Register of Deeds office in the county in which the property is located. The conservation easement runs the Register of Deeds county office in the property is located. The conservation easement runs with the land, meaning the terms and conditions stay with the land as it is transferred to buyers or heirs of the landowner. The easement is held by the applicant's organization, which can be a local nonprofit conservation organization or a county government. We have had some interest. It usually takes not a spur of the moment decision to put your land in a conservation easement. It usually takes a year, maybe a number of years for you to get everything in order for that. It's almost like having a wheel. You have to go through an attorney process. We have a landowner, Albert Shaw in Clarkton, who would like to put his 365 acres of land in a conservation easement. It's currently in mostly forestry, but pasture, cropland, and historical use. And his family understands this. It's a decision they want to make to put it into a permanent easement. In order to have that, an entity of government has to hold that easement. And our Soil and Water Conservation District Board has voted and agreed to hold that easement indefinitely, which means that he would apply with the Agriculture Development Farmland Protection Grant through the NCDA. If he is fortunate enough to receive the grant, then we're putting together the application now, and it's due about mid-December. And if he's fortunate enough to get granted, we will hold the easement in the Conservation District, which means we will be required to inspect it once a year and write a report on what we find. It does restrict the future use of this land stay in a family farm, and that's the purpose. Not asking for any kind of decision here. This is just an informative update on something new. We have had other landowners in the county look into this. We approach it with guidance from NCDA specialists with ADFP program, and they guide us in the right direction.
Mr. Mark, there's something about the easement on land. When conservation, I've had some people call me and contact me about having drainage, big canals or something going through their property where it's always flowing through it, and somehow the other side of it decided they wanted to stop that flow of water from going across that property. Does those easements exist on private property? There's no such thing.
It's usually a legal issue where you have one landowner and you have one landowner take another landowner to court. There's no laws in the state of North Carolina to prevent from blocking that ditch.
So there's no easement rights on that property. Because lots of people say that's what was happening. They breathe the land and back it up now because they have come in and cut the lead canals out and everything. Okay. All right.
Any other questions?
No, can I ask them something else, just to update on the ditch cleanup? And
We're currently working in East Arcadia. That's one place that is, the contract is as together, and I'm sure you're aware of what's going on.
about the other areas, and any other funds available to finish?
Yes, ma'am. There are ones, we do not want to put off contracts out at one time.
Okay.
The first year, we put additional contracts out in these areas of the county. It is adjustable. We have a projection plan initially. It's all adjustable as we see fit as we go forward.
Mr. Chair, at the last meeting, I think the last meeting, I asked about labor on 410.
Yes,
Have you made any contact?
yes, ma'am. I have. We will be putting a contract in place. And I believe that's Slender Branch, if I'm not mistaken. From memory, I'm familiar with it. We are going to clean it out because it does need cleaning out, but I think what we're going to find is there's some good end down there on private property that's crossing it. And as much as we do, that dam is going to limit the water flow. I know that's what we're going to find. Now, how we'll remove that dam, we'll have to probably pursue that. Why the dam's even there?
Also, Mr. Arcade, will the funds be, some areas were not completely done? Because I guess when they went out and found the branch tag, it actually ran to connect with another branch or it was a branch. And it had been done, I guess, 40 years.
Right.
Because we did find out.
Right now, this contract goes X number of feet. I believe it's 18,000 feet, if I remember. And if we do need additional footage, we would have to put it on a new contract.
Okay.
Well, we might be able to amend this one, but I'll look into that and see if we could add this one or if we could have to create a new contract.
Okay. And you let us know about
That's the first started.
Okay, I'm sorry. And would you please let me know about labor 410, because they kept calling me. They asked me to call again.
We'll put you on the agenda for next
Would you
meeting,
do
give us
that?
update on all of it.
Yeah.
Okay.
Okay.
You'll have more information about it.
Okay.
Thank you, Mr. Davis. Item 11, advisory board appointment, Clark and ETJ advisory committee.
Report.
Motion by Dr. Ophir Monroe to reappoint. Second by Mr. Britt. Any discussion? All in favor say aye. Aye. All opposed? Item B is Clark and Fire Service District Committee 3.
Report.
Motion by Dr. Ophir Monroe to reappoint. Second by Mr. Mark Gillespie. Any discussion? All in favor say aye. Aye. All opposed? And item 12 is advisory board appointment for December 21st. Mr. Martin, have you explained to the new members how certain advisory boards, it's kind of their responsibility to get with their fellow commissioners in that district? Have you talked about that?
Yes, sir, we attempted to. If we need to provide further clarification, we
Okay,
We
okay.
mentioned, I know the planning board is unique in the sense that each commissioner kind of has a nomination on.
And just remind us too, and I think Mr. Peterson will call me after, and apologize for the last time, so thank you. Remind us sometime.
Okay.
Yeah, okay. Mr. Martin?
Thank you. I'd like to review the calendar briefly for the remainder of December and January. I don't think that the chamber knows normally the chamber meets tomorrow, but I don't think there's a meeting this month.
Mr. Martin, do they put out the particulars how you can get into the meeting? I don't know.
Yes, sir. They've been having Zoom, I know they've had a number of Zoom meetings.
So you have the information where we can go in?
And you all would be on their listserv. I don't know if you,
I haven't
are you
seen it.
receiving emails?
I hadn't seen it.
Okay, I know we'll send all of you,
Okay.
all of your email addresses.
All right, thank you, sir.
On Sunday, the 13th, from 4 until 7, there's an event at the Cape Creek Farmers Market by the Unity Carolers. It's a concert, and there'll also be an opportunity to make a donation to help children's presents for Christmas for needy children. So certainly encourage you to attend that. On Monday, the 14th at 5 p.m., the Health and Human Services Advisory Committee meets. The Board of County Commissioners meets here on the 21st at 6:30. Offices are closed on the 24th, 25th, and 28th in observance of the Christmas holiday. Offices are also closed on Friday the 1st for the New Year's. The board meets on Monday the 4th at 6:30 p.m. On Tuesday the 12th at 2 p.m., the Bladen County Substance Use Disorder Task Force will meet at Bladen Community College. Offices are closed on Monday the 18th in observance of Martin Luther King holiday. The board meets on Tuesday the 19th at 6:30. I understand tentatively the chamber annual meeting is scheduled for the 21st. We'll confirm that as time gets closer, and that will be a new deal.
Also, the MLK parade normally on the third Monday has been canceled due to the virus.
I saw it. Thank you. And that's all we have for the calendar. Moving on to item B. At the last meeting, we were asked to look into some form of compensation or some plan to provide compensation to employees related to the coronavirus. And we tried to, in conversation with a number of the business managers, tried to come up with a plan to look at employees in categories. A high category, for example, would be employees who may experience potential exposure in their day-to-day work routine. And examples would be public health and public safety employees. A medium category would be employees who may interface with the public on a day-to-day basis. And examples would be housekeeping and tax office, building inspection, environmental health, those types of departments. And then the low category would be primarily employees who have minimal interaction with the public on a day-to-day basis. For instance, office support staff.
Any of these groups of people have taken on more responsibility as far as putting in more duties?
Well, yes, sir. A number of employees have across the spectrum. Without a doubt. And so the compensation, and again, this is to get the company. I don't know. We didn't really have any real direction to pursue or whatever. This is to begin the conversation and to seek your feedback and guidance. High compensation will be $450. Medium will be $300, and low will be $150.
I have a question.
Yes, ma'am.
I noticed that or comment, Mr. Chair.
Okay.
I know the Board of Education or the state, for them, they are receiving, all their employees are getting, all of them because of the CARES Act. So did our employees receive funds like that? Because each of their employees are getting so much money. Every employee.
You mean in the local school district? That must have been a decision that the school system made, I guess.
So there's no way that we can receive any type of compensation from the state or federal government to help our employees to do that.
Well, we're proposing to use our coronavirus
That's what I'm talking about.
funds to help
Okay.
Yes.
So we're not looking at just one group?
We're looking at all employees, but we've categorized them into 3 tiers, high, medium, and low.
There must be, okay.
So you're looking at, $11,058, is that what you're talking about? The bottom figure down there?
Well, that would be for the category, for the low category. But in reality, and this gets back to Mr. Bullock's question earlier, I don't know, can you all hear? We received a total, and you may recall, those of you who have been here for some time, the county received an allocation of $1,417,464.82. Through November, $785,000 has been spent. Currently, last week, the first week of December, $28,840 was paid. For the rest of the month, we have $632,000 to pay. And that's, for instance, $100,000 to the town of Elizabethtown, $24,000 to East Arcadia, $109,000 to White Lake, and that type of thing. You may recall that we talked about dedicated time of public safety employees, EMS employees, and that type of thing is reimbursable. So that would be another roughly $188,000. And this money can be used to cover the cost of that full cost of $166,000. But just to keep it simple, Ms. Copeland and I talked about this. We could submit the time for the law enforcement and public safety, and then as that money comes back, there's no question about the cost of that. So there's definitely no problem for those funds being used to pay for this. And just to let you know, Mr. Bullock will speak to answer your question in a little bit more detail. There is approximately $357,758 that is really not allocated, or that is money that is paid, that is being charged to those EMS and law enforcement salaries that is going to come back to the county, that is really a net benefit to the county's bottom line. And so out of that 357, for instance, if we used 166, then there would still be 191,000 that would be a net to the county. And I think that speaks to your question.
So on this, well, I'm looking at the sheet you gave us here with this calibration on it.
Right.
And you got $165,653.14. Which one of these totals reflect what cost would it be if you followed through this plan you got broke out?
The 166 is the total.
The 166?
Yes.
That's
And what I'm saying is there's really 357 that is available, that's net benefit to the county. So that more than covers that cost.
So this what you have here is going from the minimum to the low. If you gave it to all the people that you feel designated, that you can get it to on an annual cost.
And this is just a one-time payment. 150, 300, 450.
So, Mr. Martin, the only thing I think you did a great job. You listened to the report on this, and probably all of you work on it. It really looks good. I would want to make sure that this thing is out to all the employees to make sure that they don't feel like whether they need to be in another group or not. That's my concern.
Right, and the challenge with that is we didn't want to get the cart before the horse.
Oh, I know. I'm just saying, going forward, I want to make sure that people understand why they're there, and if they can justify they need to be in a higher bracket, then let's put them in a higher bracket.
And that was the aspect that we tried to have discussion with Health and Human Services Director, Sheriff, General Services, Emergency Services.
The last thing we want to do is people be offended by what we're trying to do here. And
oh, I know, it.
plus, because it was supposed to be in a higher bracket than someone put them. Let's just make sure that we got them categorized the right way.
When you talking about disbursements money before the end of the month?
Well, if it sits on, I mean, it's net money. I don't know what you all, this is the first time you've all have discussed it or had an opportunity to discuss it. If you made a decision at the next meeting, it would be the week following Christmas. It would be the week following Christmas.
That's what I'm saying. So I'm saying we need to go ahead and disperse it in the time frame that we need to get it spent by, right?
It is time.
Don't we have
Yeah, it would only be for time. We're only counting time through December 30th. December 30th is the cutoff. The day before not the 31st, the end of the year, but the day before the end of the year.
So we need to allocate the funds before the end of the month.
Well, no, because we're already using that, as I was indicating, we're already county for the time for the public safety and
It's gonna be reimbursed.
so it's gonna come back to the county as a net, and that's what I'm saying, there's $357,000 net dollars as a result of that to the county, and from that, we would appropriate the amount for this. And that still leaves $191,758 as a net to the county.
Mr. Chairman,
Yes, sir.
you know, you mentioned this too about some employees might feel left out or whatever. What would be the amount if we just give everybody the same thing? You want to worry about it then?
Well, that would be one thing, I mean, the only figure we heard mentioned at the last meeting, you mentioned, I think, $100 or something for housekeepers.
Yeah.
That would be one, I mean, that would be one approach. The reality is though, EMS employees who are transporting known COVID patients, health department folks who are interfacing with the sick, they have a little bit different level of exposure.
Yeah, that's right.
And that's kind of what we're trying to use as the basis for.
Okay.
But it's totally up to you all.
I think we just make sure the employees are in the right category, all that's asked.
Well, Mr. Chairman, who make that decision then about the employee being the right? Well,
Well, we've tried to work with the Department of Business. I mean, there's always some ambiguity to that as well. So that's
Have any other counties done
subject
this
to
yet? Have any other counties that we're aware of done it yet, or faced with?
There have been a few counties who have provided some type of stipend.
I didn't know if they tiered it also.
And some towns or whatever.
Yeah, a lot of them just gave, just like officers, just gave one flat rate to everybody.
And that's fine. I mean,
They gave everybody a flat rate, just like incentive for everybody being team players. They just gave one flat rate.
I would ask you to take this back to the department heads and employees and make sure that people know what we're being and make sure people are satisfied.
They give everybody the same thing.
But, you know,
There's more people at risk, there's different risks with county employees.
right. But if you put me in the low area, I'm not gonna agree with it.
Well, that's where we're gonna have an opportunity to see.
They give everybody the same thing. You got that problem goes away.
Mr. Cameron?
Well, I just think it's worth noting, not every employee of the county makes the same salary. They base their salaries based on their responsibilities, in this case, their level of risk. I think the idea that everybody needs the same, bonus or whatever one, it should be based on their risk. If it's specifically connected to the corona and all that, somebody that's sitting in an office all day long by themselves are not at any added risk. I just think that's the mindset that everybody should get the same amount of money. I mean, with all due respect, you don't make the same amount as the janitor, but the janitor understands that. That's just part of life,
But my thing is, when you say to the element of where you kind of category a person value, if a janitor goes into a restroom and cleans up a restroom that everybody uses, he's more exposed to anybody in the whole facility. He should be higher than anybody. He's the one that's doing the dirty work and getting everything cleaned up and cleaning up behind him. But you're going to put him in the minimum category?
So, Mr. Martin will bring us back his suggestion and take all this into consideration and we'll make a decision the 21st of December. So the checks can go out to clerk. Any other comments? Is that okay?
I would just say I agree with my brother there that, that obviously a janitor going into those places are, so I didn't mean to make that connection. I was just talking about everybody makes sense.
Were you going to have this next board meeting? At the next meeting?
You think we'll have it next meeting?
Yes, sir.
Yes, sir, we'll have it to you the middle of the week before the next.
Okay, Mr. Martin?
Thank you. Yes, sir. The next item, you all know, for the past few years, we've developed practices of reviewing our board policies. The first is the rules of procedure, the code of ethics, and the conflict of interest policy. And these specifically relate to the Board of County Commissioners, as well as some of them relate to county employees too, but the rules of procedure and code of ethics, conflict of interest really. So many of our county policies don't apply to board members, but these specifically do. And so I just want to bring them to your attention for review, and if you have any suggestions or if you'd like to make any revisions or whatever, please let us know. If we don't hear anything, if you let us know between now and the next meeting, we'll have it for discussion at the next meeting. If we don't hear anything, we'll just plan to include these on consent items for adoption at the next meeting.
Mr. Martin,
Yes, sir.
on item C, 13C, have we posted downstairs that our meeting is now here? Have we done that downstairs?
It says in the Spirit Board.
Downstairs?
Yes, sir, I mean, but it's posted on the bulletin board beside the door.
Okay, okay,
It says, and when people come in the front door, Tom,
all right.
the deputies let them know they're ready.
Thanks, sir.
Okay, thank y'all. Thanks, Rick. Thank you, Martin. 14A, considering in closed session.